All right, in this video we are talking about cellulite. What is it? Why do we have it? And what do we do about it? Cellulite is a really big issue for a lot of women right now, and there are so many factors that go into it. So I wanted to really break it down in a way that's easy to understand so that we know how to work with it. So cellulite is clumps of fat that is bound down by connective tissue. And we can have cellulite even if we're quite slender, because in that case there's not a lot of fat bound down by the connective tissue, but that connective tissue is still bound down. What does that mean? So connective tissue in this instance is called fascia, and fascia is like a web through the body of specialized tissue that gives support. And if we have a weakness in the body, our body will lay down layers of that connective tissue. And it will often lay it down as scar tissue. And what that means is normally connective tissue as fascia is very organized. The fibers go in nice aligned directions, following lines of pull in our bodies. In Chinese medicine, we call these lines of pull meridians or pathways, or sometimes myofascial meridians. Sometimes I'll call them circuits. There's a lot of names for them. But essentially, these are lines that developed while we were still in the belly, while we were still even in embryo. And they follow nervous system pathways, circulatory pathways for blood and lymph, lines of muscles. And so the fascia will go along these lines and make sure that we are supported all throughout. A lot of times when we have weakness around the joint, we'll get a significant amount of fascial buildup in order to support. For women, this often will come around the hips because our hips tend to be wider than men's. That makes them more unstable. And if we have a lot of hip weakness, if we have a lot of issues in our legs, it's likely that we have hip instability. This will often show in modern times as what's called a leg length discrepancy, which means that one leg is slightly shorter than the other. And this becomes more pronounced over time in what's called a functional leg length discrepancy, meaning that tiny bit of space that one side is off will get worse over time as our hip becomes jammed and we start to kind of lean into it. And this can be an issue for the entire rest of the body because our legs and our hips really are the foundation for a healthy spine. And a healthy spine is a foundation for a healthy rest of the body because that spine houses our spinal cord and our body nerves that come out from it. So if our spine is off even a little bit, it can be compressing a nerve. And even a small amount of compression on a nerve can cause a disorganized signal to a part of the body and cause numbness or pain or any type of dysfunction really. And that can also affect our internal organs, our intestines, our liver and spleen, our womb, our prostate. And so we want to really make sure that our hips and our legs in particular are in good working condition. So if you do have cellulite, even a small amount in your thighs and hips, then you, in my opinion, as a practitioner that pretty regularly works with fascia, it's really important to deal with it as soon as you can. As we age, it's likely to just keep getting worse, and if our hips are not in optimal shape as we age, that can set us up for needing a hip replacement or actually breaking our hip in the future. And I think we all want to avoid that as much as possible. So working on our cellulite and creating stability in our hips right now, as soon as we can, becomes even more important. Then we get into the beauty aspect of it. It just doesn't look good, and we don't feel good when we don't feel like we look good. One nice thing to note is that pretty quickly, when we start using myofascial techniques over cellulite, we actually get a pretty significant smoothing of the top layers of tissue, meaning our skin looks smoother. We have less dimpling, and the skin gets thicker, so it's less likely to show even if there is connective tissue being bound down underneath. As we work through the layers, we start to break up that connective tissue. And as we get into an intermediate stage with cellulite care, it can look a little clunkier for a bit. But once we get to the deeper layers and really start to break those down, we can actually get rid of cellulite. And that's a really important thing to note. It's not a quick fix. It's not just using a cream and it magically goes away. But over time, we can actually break down that connective tissue that's binding down our other tissues, that's binding down our fat and causing that dimpling or clumping look, that's binding down our muscles so that they're dysfunctional. When our muscles are bound down by connective tissue, we're not able to contract and relax them effectively, so they can get stuck in either a chronic state of spasm or just not be able to work at all and start to atrophy, start to break down. And as we age, we really need as much muscle tissue in optimum health as possible, because our muscle tissue kind of naturally starts to break down as we age. The amount of muscle tissue we have that is functional will directly affect our metabolism. So when we have a lot of muscle tissue, we're burning a lot of calories just at rest. If our muscle tissue is bound down by that connective tissue, it's not burning as much calories, whether we're resting or working. And that becomes a significant issue when we are trying to release excess weight that we don't need anymore, that we don't desire anymore. So with joyful weight balancing journeys, one of the main things I work with women on is making sure that their connective tissue is smooth and even all throughout their bodies, that their joints are supported, so that as we start to build our metabolism and naturally want to move and play more, we can do that with ease and grace and without potentially causing injury and that connective tissue dysfunction again. Another aspect of cellulite care that we need to address for most people is the aspect of the liver and detoxification. This is a little different than most people think about detoxification, because we're not necessarily thinking about doing a cleanse. What I am talking about is just supporting the liver. On one hand, giving it more space to function properly. Often in our right-sided dominant societies, we'll be leaning to the right slightly, compressing and putting a lot of pressure on the liver and gallbladder area. This is especially important for us women because we tend to have more liver and gallbladder issues than men anyways, just because we're constantly processing so many hormones with our menstrual cycle, with pregnancies, with lactation, with all of this stuff. Excuse me. And we have so many synthetic estrogens and toxins to process from our environment right now anyways. So our liver tends to be pretty regularly overburdened. Unless we're, living in the country and we're in optimal health and we're getting regular exercise and eating really great. The other thing that can really affect the liver is stress. So in our modern lives, we're often, pushing hard, stressed out, worrying about something at all hours of the day and night, eating likely not optimal foods, probably not enough vegetables, definitely not enough green vegetables, probably too much sugar, too much, hormones from the meat we eat or the dairy we eat. All these things start to add up. And then when you add in things like birth control and, plastics and all of that, it really does end up being quite a burden on the liver. So if you have any discomfort in this area, or you pinch up the skin and it's really sticky, or you can't twist very well, or you have menstrual issues, or cellulite, those are all signs that your liver is really struggling. And the connection that has to cellulite, the direct connection, is that when our liver is struggling, it's not able to process all of the hormones and toxins in our blood. So they start to build up, and our body can't allow all of those things to build up in our bloodstream. It needs to have clean blood so that it can circulate nutrients and healing properties to all areas of the body. So when these things start to build up in the blood, our blood says, oh no, we need to isolate these things. We need to get them out of here. So it stores them in fat. These are fat-soluble items, hormones, plastics, other things like that, pesticides, get stored in fat. So they'll store them in fat, usually around the hips and the thighs, especially in women. We don't tend to store as much fat in our bellies because our body doesn't want those toxins near our womb. So we'll put them in the hips and thighs, and we'll start to gain weight. Our metabolism will go down because our body needs to store fat. So if our metabolism is high, we're not going to be storing fat because we're burning it. So our body will shift more into a fat-saving mode versus a fat-burning mode. When we store these things in fat, they tend to get stored in a very stubborn type of fat because our body doesn't want that fat easily broken down and these things recirculating through our bodies. Often, when we decide we want to lose weight and we have a lot of things stored in that stubborn fat, we'll need to push very hard. We'll need to diet really intensively, or we think we do, and exercise and push ourselves really hard to burn it. When in reality, what we're likely doing is releasing all those toxins, so our body lowers our metabolism even more in an attempt to isolate them. So it's a really vicious cycle. Then we end up eating less to try and lose more. We end up exercising harder. And all of those things keep pushing our metabolism lower and lower till it gets to a point where our thyroid is affected, and our liver is still struggling. And we still have these hormones built up in our fat, and we just can't seem to lose the weight. So our cellulite gets worse. We gain more weight. We have less energy. Pain starts to build up really bad, and then we shift into more of a fibromyalgia syndrome. So that's why it's important to get this from every angle and to do it as soon as we can. If you have chronic pain, excess weight, PMS, things like that, just know that there are things that you can do that are really effective. They're not a quick fix, but we can definitely take care of it. So the other connection with the liver and cellulite is that the energetics of our liver in Chinese medicine, it helps to get things to move. And it creates bile, which helps us to digest fats. If the liver is not functioning well, it's not going to be producing a lot of bile. And so we will be unable to break down the fats that we eat. So they'll just get stored in our body as well. When the liver's not functioning well and it's not sending regular fats to the gallbladder will get sluggish. The gallbladder is like a little bag that holds the bile, and it concentrates it for when we need it. But if it's not able to get regular infusions of bile, it's just going to kind of sit there. And a sluggish gallbladder, will cause us to feel a lot of pain on the sides of our body, and we'll start to lose our courage. We'll start to lose our gall. That's a pretty old school word, but I think it's really applicable. Our gall is like our nerve, our strength and our conviction behind our actions. And so it's common as we age, as women, especially kind of that late 20s, 30s, early 40s, to struggle with expressing our convictions and following through on our actions. And that's a sign that our liver and gallbladder are struggling. So, and then, we can even get stones, and that's really common in women as well. So we want to make sure that our liver and gallbladder are really in optimal health, not only for our general health, but for being able to process the hormones that can affect our cellulite and other toxins, for making sure that we have a strong source of healthy bile to help break down not only the fats that we eat, but any fats that get broken down and circulating in our bloodstream. And then, yeah, just to be able to keep things moving throughout the body. Our liver is like the manager of our body, or like the high priestess. If we think about our body as a temple, the liver is that executive, that chief empress organizer who's like, okay, we're gonna get this shit done. We're gonna make it happen. We're gonna move things and make them happen. And if it's not healthy, it's going to be harder for us to tap into that energy. And that's why often when we have cellulite built up, we just kind of live with it. We think, oh, this is inevitable. There's nothing I can do about it. I'm here to tell you there is, but only if you get it on all of these different levels. If you just slap some cream on it or do a little coffee scrub once in a while, it's going to look good for a little bit, but really you're not getting to the root of the issue. So how do we get to the root of the issue? My favorite cellulite care technique is myofascial care using cupping, blading, blasting, self-massage, acupressure. So manually getting in there and working that shit up. Because it's bound down, it has these links, right? And we can break down those links. It's not easy to do it by stretching, and that's for a number of reasons. One is when it gets laid down as scar tissue, it's not smooth and even and ordered like it is naturally in our body. Scar tissue is like a crisscrossed web that comes in from a number of directions. And this really helps support and increase strength and stability around our joints, but it makes it very difficult for strengthening and lengthening. So we want to break down those cross links, so we do it in different directions. We go one way and then we go another. And I'll show you more directly how to do this in the cupping and blading and blasting videos. But that is essential for breaking it down. And it's one of the most effective things I've found. So cupping will help to increase circulation in an area. When the muscles are bound down, they're not getting circulated, starts starving the nerves essentially, so they can't function. So we get pain signals sent to the brain. Then we get disordered pain signals that can't really get there all the way, so we get numbness. And it just gets worse and worse. But if we break down those cross links of that scar tissue, scarred connective tissue, we get the circulation back in there, we free the muscles so that they can begin to contract and expand, pulsing nourishment, pulsing blood through, keeping our body warm and healthy and strong. Our feet will start to be warmer. We won't have chronically cold feet. Our spider veins and our varicose veins will lessen because the blood can flow through that area again like it needs to. There's all kinds of benefits that come with this work. So it's not just about beauty. It's about a deeper level of health. When we clear that scar tissue in our hips and thighs, it makes it easier for the rest of our body to function as well. So the next thing I like to do is look at nutrition. And I look at nutrition a little bit differently than most nutritionists do, even holistic nutritionists. I'm definitely a holistic nutritionist, but I also really strongly believe in intuitive eating and mouthgasmic eating. So I believe that we need to eat things that make our mouth water, that turn on our digestive juices and really get our juices flowing. And if we don't do that, we're just really adding to the problem. We're putting, a big clump on top of a cold fire, and it's not going to digest. We're not going to get the nutrients from it. So yes, we want to eat healthy. We want to eat as healthy as possible within the range of what makes our mouth water. And that's going to be different things at different times for different people. Before our moon, we might really be wanting chocolate to make our mouths water. And we can learn, why do we want that? Part of it is because of the sweetness. Part of it is because of the magnesium to help relax our belly muscles. So we can learn, I'm craving this. I need to give my body some magnesium. After that, if you're still craving chocolate, go for it. Let it make your mouth water. Let it create a little orgasm in your mouth. Make your tongue dance. So there's all kinds of things that we can work with around nutrition to support our digestion, to support our liver, to support the quality of our blood and circulation. Deep hydration is another one. When our muscles are bound down by that connective tissue and they're not getting circulation, they basically dry out like jerky. And this is common with aging and can be amplified when we do have those connective tissue disorders. Another thing to note, if you're interested in orgasmic health, is that when we do have connective tissue dysfunction over a muscle, the muscle is a lot less likely to be able to orgasm. And we can have connective tissue binding down our wombs and our vaginal canals, especially if we have inflammatory issues in the digestion. But when we can learn to release the connective tissue blocking our muscles from contracting and releasing, we can actually orgasm anywhere in the body. It's just a matter of stimulating the nerves in a certain way. And we do that with rhythmic pulsing and different types of touch and movements. So there's a lot that can be done with that. So we've talked about manual care, getting in and breaking down the connective scar tissue. We've talked about supporting the liver and supporting the digestion with intuitive and holistic eating. Herbal care is really important, definitely for supporting the liver, for getting rid of any phlegm that's built up in our digestive system and sluggishness in our blood, and helping to get rid of any of those toxins, the pesticides, excess hormones, anything like that that has built up. Movement is really important, and it's very important when we have cellulite to learn how to move correctly, to learn how to stand correctly for optimum use of our joints. Often the way we move isn't super effective and can actually cause issues with our joints that can affect our whole body. And unfortunately, this is true with most exercise programs and even with a lot of yoga classes. When we have connective tissue dysfunction, even a regular yoga class can actually cause issues because that connective scar tissue can be as strong as steel. And when we're pulling against it, our ligaments, our naturally, formed connective tissue, are way more likely to overstretch, and so we can cause more issues by forcing a stretch than we even had to begin with. So I do the opposite of stretching with my beginning clients. We actually learn to soften and relax the muscles by shortening them so that we can get a deep relaxation while we're breaking down that connective tissue. Once the connective tissue superficial layer is broken down, we can add in gentle stretching and meridian stretching to support the lengthening of the connective tissue and the reorganizing of the fibers. And that's all very effective. Once all of that you've worked with all of this for a little while, we naturally start getting more energy and wanting to move in more joyful ways that feel really good to our body and support its function. And at that point, we can add in all kinds of activities to really make sure that our muscles are getting toned, lengthened, strengthened, and flexible all at the same time. So a lot that can be done with that. Another aspect of cellulite and connective tissue care that is very important is our mindset. Why are we doing this? Are we doing this because we are ashamed? Are we doing this because we don't feel like we're good enough? Or are we doing it because we're honoring our bodies and we know that we need to do something to help ourselves shift out of this pattern? And having that mindset, even though it can be a subtle shift, is actually very important. Because when we're doing this process as a self-honoring, we're more likely to be consistent. We're more likely to be happy to be doing it versus feeling like we're forced to be doing it. And it's not a process that we can force because it does take some effort. We want to be feeling like we're doing it from a space of self-love versus self-hate. Otherwise, we can actually take it too far and cause more damage, more issues than we had in the first place. So that's my little intro to cellulite care. There's lots more that we can do with it, and I am planning a webinar where we can get a little bit more into those processes that we can use to support our care. And then I am about to release a short course on cellulite care, and I also incorporated into my Embodied Empress one-to-one programs, meaning that you can use the course and also have direct support from me in creating a really customized program for maximum benefits with the least amount of effort, and learn how to really easily and effortlessly incorporate the care program into your life. So if you have any questions, let me know. I'm happy to support anyone that needs this work. If you want to join the free webinar, definitely shoot me a message. And if you want to just jump into supported care now, I'm happy to be there for you. I'm taking on a limited number of sliding scale clients, which means that whatever your income level is right now, you can pay according to that amount. So a really great benefit for all women right now. So get in while you can. While I have time, I'm booking up pretty fast, but I do want to be able to help as many women as possible through this process. So let me know if you have any questions, and I'll talk to you soon.